Good morning, Acrisure. My name is Lynette Bates. I'm Senior Vice President of Business Development for Womberg Genomic Advisors, and we're very excited to be able to talk to you all today about a very new and innovative employee benefit program that our firm provides called Cancer Guardian. So our firm, Womberg Genomic Advisors, is a brokerage advisory firm that specializes in genomic-based employee benefit programs. So all of our programs have some level of genetic testing incorporated into the program. And, the Cancer Guardian program that we're going to talk about today, I think as you learn more about the program throughout our presentation, you'll see that this is something really new and exciting that you can talk to your existing clients about that will show a lot of thought leadership and forward thinking outside the box as, their consultant, but also a great product to use as a prospecting tool to kind of get your foot in the door for, new clients out there that you have your eye on, a way to show them, again, that you're keeping a pulse on, the newest, most innovative employee benefit programs. So without further ado, let's go ahead and dive right into the mechanics of the Cancer Guardian program. So this program is a new program that was really put in place to provide tools to help an individual to be able to identify their genetic risk in advance and address the challenges that individuals are often presented with when they're dealing with cancer. So this program really helps to solve the problem of awareness, access, and affordability to services that can really help an individual improve their prevention and ultimately their overall survival. And I make that statement, awareness, access, and affordability, very purposefully. We determined all of the services that we included in the program that I'm going to talk about throughout our presentation today, very specifically based on, where we're seeing that people are not typically getting access to these services or being made aware of them because they are not affordable to the masses, generally speaking. These are services that are typically not reimbursed for by medical insurance, so the majority of patients who are being treated in community hospital settings are typically not being made aware of these. So our program has really packaged these services in a very affordable, accessible way that can be made available to the masses. All right, next let's talk about, the devastating impact of cancer. I'm sure that these, stats are really no surprise to any of you listening in here today, given the industry that we all work in. But these are some good reminders around the rise in cancer incidence. Individuals born today in the United States actually now have a 50% chance of developing cancer at some point in their lifetime. And cancer is actually scheduled to surpass heart disease as the #1 cause of death in our country by the year 2030. So it's definitely a growing problem. We are living in the disease of the aging, and so with that, the cancer incidents continue to rise year over year. Cancer is the second leading condition impacting healthcare spend. That has a very significant impact at the employer level when you think about managing healthcare utilization and overall healthcare costs, but also on the individuals who, employees and their families who are having to, spend out-of-pocket dollars for chronic conditions like a cancer diagnosis. So this next slide right here really talks about, the challenges in today's standard of care that we see when we're thinking about a cancer diagnosis. A stat that a lot of people are really not familiar with is the misdiagnosis rate in cancers. Actually, 1 in 7 cancers are reported initially misdiagnosed. That's actually a pretty conservative number. There are reports that have been published that look at the misdiagnosis rate by specific cancer types, and there are certain types of cancers that have a misdiagnosis rate greater than 40%. So it's definitely a really big concern because what that means is that we're putting people on treatments that they're more than likely not going to respond well to because that initial diagnosis is incorrect. So that's going to lead to wasting, very precious time for the individual and wasting, resources, monetary resources on treatments that are going to be less effective, and it's ultimately going to result in poor outcomes for the patient. Cancer is very much a genetic disease. There's no question about that in the oncology community. But unfortunately, what we're finding is that only about 15% of cancer patients today are actually getting access to an advanced DNA test of their actual cancer to help better guide their treatment path. And, that really comes into play because 80% of cancers are treated in a community hospital setting, where kind of the standard route to treatment is more universal. It's chemo, radiation, maybe some surgery. It's unfortunately kind of a trial and error approach at times, where you're putting someone on the standard dose and then waiting to see what side effects they have and managing those, versus, more personalized options that are available to individuals if you have access to the right genetic data about their cancer. So we're typically only seeing that this advanced DNA testing of an individual's cancer that can provide that information to opening the doors to more treatment options. We're only seeing that about 15% of patients get access to those, and that's really driving down to patients who are being treated in a research facility, or they have some level of involvement with a concierge medicine practice. But in a lot of those cases, those are geared towards high net worth individuals. It's not always feasible to get those services to the broader masses, and that's why you're seeing, majority of cancers being treated in a community hospital setting where they're lacking some of those resources. And this study here was a survey that we had done where we surveyed a group of cancer patients, and then in addition to that, we surveyed some caregivers as well. And, the results here were kind of surprising to us, but they definitely did kind of reinforce the notion that cancer patients need more support. 1 in 2 individuals that we surveyed actually indicated that they had no knowledgeable advocate to help them in finding a treatment for their cancer. And about 30% of the individuals that we surveyed said that their healthcare experts couldn't agree on a treatment plan. So that's obviously going to leave people feeling, very unsupported and possibly very confused, and that's what leads people to, go jump online and start doing their own research. You jump on Google and type in the word cancer, and over 1 billion search results appear. It can be very overwhelming. It's very difficult to know what is validated and sourced information. So, cancer patients really need more assistance with this. And about 10 to 15% of cancers are due to a hereditary gene mutation that gets passed down from your family members, but the majority of individuals are unaware of any, hereditary risk that they may have as it relates to becoming diagnosed with cancer at some point in their lifetime. And so with that, addressing all of these challenges that I just talked about as it relates to challenges in the standard of care and rising, misdiagnosis rates and the rising cancer incidence, that is how we really created our Cancer Guardian program and carefully selected the services that are included in this program. And we really believe that this is creating a more effective path for individuals who are dealing with cancer. So let's talk about the key features of the program. So our program has 3 core pillars to it. The first one being our cancer support specialist. So this is really that dedicated, compassionate, humanistic support for patients who are dealing with cancer. These are our oncology-trained experts that really kind of take the burden of having to do research and, feeling confused about information. Our cancer support specialists are there as a resource for patients. The second pillar of our program is the advanced DNA testing. Now, this is really the big differentiator of the program. There's 2 levels of DNA testing, or genetic testing, as you often hear it referred to in our program. There's a test that I'll speak about in detail that all of our participants are given access to as soon as they become effective in the program, and that's more of a preventative risk screening test that's going to give someone their potential risk for developing cancer and a number of other conditions based on their genetic markers that are passed down to them from a hereditary component. And then there's a post-diagnosis testing that's included that's going to help any patients who may become diagnosed with cancer to help better guide their treatment path and look at treatment options outside of just chemo and radiation by matching them to treatments based on the specific genetic markers in their cancer. And then the third pillar is our technology piece. This is going to be our medical records platform that we've included to really help kind of ease the burden of dealing with medical records. It can be very daunting trying to collect medical records from different providers, storing them, sharing them, and so we've got a really nice cloud-based solution that really breaks through some of those challenges and makes it more efficient for individuals to be able to deal with their medical records and to communicate with their physicians. And again, this program is making these services available through an affordable monthly program charge, and these are services that were typically not going to be made available or covered by medical insurance. So first, let's talk about the cancer support services. So there's two components to the support pillar of our program. The first one being our Cancer Guardian information line. And this is a resource for anybody who's enrolled in the program and their immediate family members, including parents and parents-in-law, to get expert information on any type of cancer-related question. This does not require a diagnosis. I like to think of this as a very cancer-specific EAP program. So any of our participants can call our oncology-trained experts and ask any type of question relating to cancer. Probably one of the most common questions that we see coming into our information line are around someone's potential risk for developing cancer. With, when somebody has a family member or a friend that's diagnosed, it immediately starts to trigger all of these questions in their mind around, what does that risk mean for me, and what are preventative measures that I can take to mitigate that risk? So our oncology experts can really help individuals with those questions and equip them with validated sourced information to help them feel more empowered and in control of their health. The second piece of our support services are our dedicated cancer support specialists. So this is when one of our participants actually becomes diagnosed with cancer. We then immediately assign them one of our cancer support specialists. These are oncology-trained experts, all with nursing backgrounds. These are our employees, and they are there to support the patient throughout their cancer journey. They're by no means practicing medicine or trying to overstep anything that the treating physician is doing. They're really there to partner with the patient and the treating physician to help support the patient. They're really there to spend that time with the patient that a lot of doctors, unfortunately, just don't have the time in their schedule to do because of all of the different things they're managing on their plate every day. So our cancer support specialist will first start by conducting a personal support review with the patient, and that's going to be the time to really speak with them about where they're at in their cancer journey, address any questions that they have, or maybe some things that sound confusing to them that their doctor is communicating to them. And our specialists can really help kind of put that in understandable layman's terms. And they'll be checking in with the patient on a very regular basis. We let the patient really set the cadence for that check-in. We have some patients who, only want to speak to their cancer support specialist every other week. And then we have other patients who speak to their cancer support specialist every single day like clockwork. So it really just depends on the level of support that that patient is looking for, and then we will mirror that cadence. Our cancer support specialist will provide customized information and resources back to the patient that they can refer to based on the different questions that they're asking their cancer support specialist, or maybe trends that the cancer support specialist is seeing seem to, raise some concerns or confusion for that patient so that they have that information to refer back to. They'll also provide access to an on-site nurse navigator. And this is an ability to have a nurse actually attend a doctor's appointment with the patient. And this is really great, especially for individuals who don't have family members close by, and they want to feel empowered by having somebody who is, expert trained in cancer and anything, related to cancer, that can really help them make sure they're asking all the right questions at their doctor's appointment and make sure that they understand all of the next steps that are being communicated by their physician. Our cancer support specialist will also work with the patient and their treating physician to order a second opinion pathology review. And this is a really important feature that we included. And the reason that we included it is going back to that initial misdiagnosis rate that I mentioned previously. 1 in 7 cancers are initially misdiagnosed on average. Again, there are some misdiagnosis rates even greater than that. But having access to a second opinion pathology review through a third party separate from where the patient's being treated really gives patients the confidence and the peace of mind knowing that they've had a full review done of that, a true third-party unbiased review of their pathology results to ensure that they have an accurate diagnosis. All right, so the next portion of the program is our DNA testing component. So first, when an individual becomes enrolled in the program, upon their program effective date, they're going to receive access to a preventative hereditary genetic risk screening test. And we partner with a company by the name of Color Genomics out of the Bay Area that provides a really great, very comprehensive risk screening test. So with just a simple saliva sample, our participants can get a report back that's going to identify any genetic risk that they may have from their hereditary genes that were passed down to them that would put them at an increased risk for any of the cancers listed on this slide, any of the heart conditions, and any mental health or behavioral health medications. Your genetics have a big impact on how somebody responds to medications, and with behavioral health continuing to be a leading driver in disability, that is very important to include medication response for mental health drugs. And the report will actually be adding responses to pain medication and heart medication soon. Anybody who's taken the test will not have to have the test redone. They'll just get a refresh of their report that gets sent to them. So this is really powerful information for individuals to be able to use to be more preventative in their healthcare plan and, take more proactive preventative measures to mitigate any risk that they may have for any of these conditions listed here as it relates to their risk based on their hereditary genes that are passed down to them. And, being able to have that information and being more preventative can have a significant impact on someone's outcomes. If you catch cancer in a stage 0 or 1, you actually have a 4 times likelihood of hitting that 5-year survival rate or full remission if you catch it in an early stage versus an advanced stage. So having this information to be more preventative is going to help people catch cancers in a much earlier stage. That also equates to cost savings as well. It costs much less to treat an earlier stage cancer in comparison to treating a late stage cancer. So there's monetary benefits there for the patient and ultimately also for an employer who's seeing that utilization hit the group health plan. This test also does come with unlimited genetic counseling. So any individual who takes this test, they will have the ability to set up a phone conversation with a genetic counselor and a clinical pharmacist to review all of the results and understand, how they can take that information and use it to be more preventative. And because of our agreement with Color Genomics, this genetic counseling is unlimited, so individuals can call back in and speak to their genetic counselor as much as they need to feel comfortable with the information that was being communicated to them. So that's the preventative hereditary risk screening test that's made available to all of our participants who are enrolled in the program at no additional cost as soon as they become effective in the program. Now, this is very great information for being more preventative, but as I mentioned, only about 10 to 15% of cancers actually come from a hereditary gene mutation that gets passed down to you. The majority of cancers come from genetic mutations that we acquire throughout our lifetime, and that comes from things like environmental, behavioral, lifestyle factors. That's where the majority of cancers come from, and so that's why we've included this next piece of DNA testing in our program. This is post-diagnosis advanced DNA testing of the actual cancer. So this is a test that would be made available to any of our participants if they became diagnosed with cancer while they were enrolled in the program. So what this is going to do is it's going to do DNA testing to outline the genetic profile of their actual cancer to better guide their treatment path. So what it's going to do is provide a very detailed report back to their treating physician that's going to outline all of the genetic markers that are driving that patient's cancer. And so that information in conjunction with that second opinion pathology review is going to be really powerful in helping to reduce the risk of misdiagnosis. Then the report is going to actually qualify that patient for any of the more advanced treatments that they may be a candidate for based on the specific genetic makeup of their cancer. So some examples would be targeted gene therapies, immunotherapies, and even clinical trials. And these tests can be very costly because, unfortunately, they are not reimbursed for by health insurance broadly. They run upwards of $7,000 out of pocket just for one test. And that is really why we're seeing that, the broader scope of physicians are not ordering these at the onset of the diagnosis. The majority of cancers are treated in a community hospital setting, and a lot of these facilities are not wanting to put that additional financial burden on their patients, especially when you're dealing with an illness as serious as cancer, and there's going to be, a pretty big financial hardship when it comes to paying for treatments and things like that. So having access to this test through our Cancer Guardian program gives people access to this test at a much more affordable and digestible pricing option, and it gives them the ability to get access to this test regardless of where they are being treated at. And we actually include up to 3 tests per individual as a lifetime maximum in the program. And that's really important in giving people peace of mind of knowing that they have multiple tests available to them should they need them. Some examples of cases where an individual would need more than one test would be if, they went on treatment, they got into remission, and then their cancer came back. Then they would have the peace of mind of knowing that they have additional tests included in the program that they're not going to have to pay anything additional for. Or there are some cases where physicians are starting to order more than one test while their patient's going through treatment just to track the progress of the treatment and make sure that the cancer hasn't mutated any further to, that would give them information if they need to make some adjustments to the treatment. So again, very big economic value when you think about being able to pay for a monthly program like this that's going to give you access to 3 tests that can run upwards of $7,000 out of pocket if somebody didn't have access to a program like this. All right, and this next slide here, this is a clinical study that was done for a group of non-small cell lung cancer patients. And, these group of patients, they had gone through several other rounds of treatment that unfortunately they were not responding to. And so this testing was really done with this cohort that was analyzed here as, sort of a Hail Mary, a last-ditch effort to see if they could get any responses from these patients. And, the results are, very alarming in showing how much impact that having that additional DNA information can have on someone's overall survivability. So the first group of patients, they had the advanced DNA testing done, and because of that genetic information, they were able to get qualified for a targeted matched therapy. And the patients in that group had an average survival rate of 31.8 months. In comparison to the second group, who did not have any DNA testing, and they only were able to go through the standard of care. So chemo, radiation, they were not able to get on a matched targeted therapy. The average survival rate in that group was only 12.7 months. In comparison to the last group that opted for supportive care only, no treatment, no DNA testing, and the average survival rate there, no surprise, is only 5.1 months. So you can see there's a staggering difference in the overall survivability for individuals who have access to that genetic data and are able to get on a targeted therapy that's really more precise for their cancer. And, it's important to note that these patients were all very, very late stage. They had already gone through several other rounds of treatment. So when we're getting this testing done for people right at the onset of their diagnosis, that's when you're seeing even longer survival rates and in a lot of cases full remission for those patients. All right, and the last pillar here is our medical record storage platform. So this is that technology component. We've included a secure HIPAA compliant, it's a cloud-based solution for storing and transmitting medical records. And what's really great about this is that our participants can start using this system as soon as they become effective in the program. This does not require a cancer diagnosis. We want our members to use this and be able to, start loading medical records for any type of condition from any type of doctor so that they have that convenience of knowing they have all their medical records in one place and they really control and own that data. It really gives patients the freedom to, connect with their clinics, maybe family members, other doctors, insurance providers, maybe their cancer support specialists in a much easier and more convenient way. You can invite physicians to upload medical records for you into the platform. You can load them yourselves, can actually arrange for teleconferencing with physicians and other family members that may be located throughout the world. The platform is really cool feature where everyone can kind of log in and have video conferencing capabilities with each other at the same time. Physicians can upload scans and annotate them so that everybody is hearing and seeing the same messages at the same time. So it's a really great feature, especially for, people who have family that's spread out throughout the country and they want to, feel like they can still be involved in their family members' care and, participate in those doctor's appointments. So it really kind of makes things a lot more efficient and convenient when dealing with medical records and interacting with physicians. We also actually include access for this service to parents and parents-in-law of any of the employees that are enrolled in this program. And the idea there is that, if my parents were to be diagnosed with cancer, I'm going to want to be pretty involved in their care. And so this is another way to help kind of make that more efficient and easy to do. So this slide right here is a program services grid. So this is just kind of a snapshot of all of the services that an individual would have access to based on, the employee and spouse enrollment. So if an employee enrolls themselves and their spouse, they're going to have access to all of the services that I just went through that are included in the program, and that's all going to be covered by their monthly program charges. They wouldn't pay anything additional. It's all included for their through the program charges, Dependent children up to age 26 are going to automatically be included through the employee's enrollment at no additional cost. They have access to all of the same services with the exception of the hereditary risk screening test. And that's not included because you typically do not do a risk screening test for a minor unless there's a medical necessity. So we will make it available for dependent children that are over age 18 at a discounted price. So they receive a $30 discount off of the retail price, which is typically about $250. Parents and parents-in-law of an employee who's enrolled in the program, as I mentioned previously, they're automatically going to get access to the Cancer Guardian information line and the medical records platform at no additional cost. That's automatically included in the employee's program. So that's a way to kind of give them access to some of the services because their son or daughter is enrolled in the program. And then if a parent or parent-in-law were to ever face a cancer diagnosis, we will actually make available to them, if they choose to take advantage of them, the services that do require a diagnosis. So the second opinion pathology review, the on-site nurse navigator, and the advanced DNA testing of the cancer. So those will be made available to the parents or parents-in-law of an employee that's enrolled in the program at a reduced retail price. So again, just another way to make sure that the whole family is at least getting some level of access to these services at a more affordable price than having to go, purchase these on their own on an individual basis. All right, so let's talk about the program pricing. So the program can be rolled out 100% employer paid, 100% voluntary. We also offer shared contributions. We can be very flexible depending on your client strategies. Our standard program pricing for employer paid is a $16 per individual per month composite rate. For monthly voluntary, we look at 3 age bands. Under age 50 is going to be $18 per month. Age 50 to 64 is $22 per month. And over age 65 is $26 per month. And these are issue age rates, so they do lock in at the time that they're issued. As I mentioned previously, dependent children are included up to age 26 at no additional cost. And the program is fully portable. So if somebody leaves their employer for whatever reason, they can continue the program on a direct bill basis with us. Nothing would change about the plan design and nothing would change about the premium. They would pay the exact same rates that they're paying through their employer. And these are standard program pricing. For larger groups, you're looking at over 10,000 lives or so, that's where you would want to work with us directly on, a custom proposal and custom pricing. So let's talk about, the best types of prospects. We get questions all the time around, what type of industry are you seeing that's gravitating towards this benefit, or is there a certain size segment? And really it kind of runs the gamut. We have a very wide mix of industries within our book of employer groups, all different types of sizes. We have a 3-life law firm. We have a 10,000-life tree trimming company, a 1,000-life metal fabricating company. We have several financial institutions. We have a couple of community hospitals. We're actually working with a few of the research facility hospitals as well on a rollout this year. So it really does kind of run the gamut. And I think that we don't see traction in one specific industry over another because cancer doesn't discriminate. Every employer feels the impact of cancer. It doesn't matter really the industry that someone's in. Their employees are all susceptible to that rising incidence of cancer that we are continuing to see. So I think that this really, a program like this that's very cancer specific really resonates with most employers. But what we are seeing and kind of some trends around when you're trying to identify, prospects that this may be good to kind of open the discussions around, obviously employers who have any sort of, cause marketing or nonprofit affiliation with any sort of cancer organization. Those are groups that always, immediately gravitate to this type of program. Or maybe if you have any employer clients who are very sensitive to their cancer burden, maybe they know they have a little bit of a higher than average cancer incident and that's really the biggest driver of their healthcare spend. Or, when there is a cancer diagnosis within, the C-suite or senior management or somebody's, spouse, that's really where you see a lot of, the leadership and decision makers really getting behind putting a program like this in place. And, it's ultimately a way to really support employees and provide a whole new level of support for something that really has such a big impact on employers and their employees. We get requests all the time from brokers who have a lot of tech clients who are always looking for that new innovative program. This is absolutely something that, to talk to about those, tech type companies that are always looking to be, at the rising cusp of the newest innovative benefits. And the part I know you've all been waiting for, broker commissions. So there is revenue to be made with bringing a new program like this to your clients. We offer 2 commission structures. So we can do a flat 10% year over year, or we can do a high-low commission structure. So I know typically when there's an enrollment firm involved and you're trying to recoup those costs for enrollment expenses, you'll typically want to gravitate towards that high-low option. So the high-low option is going to be 50% first year and 3% ongoing in renewal years. Here's a couple of case studies here of some real clients that we've rolled this out to recently. This is a smaller group, about 175 lives. They were a financial institution, and it was a really cool case. It's not a huge one, but there was an enrollment firm involved, and they had really been having some challenges with this client and being able to get access to re-enroll the rest of their voluntary benefits. And so they proposed Cancer Guardian to the decision makers at this company, and the decision makers immediately jumped on board and said, we have to do an active enrollment. I want all my employees, sitting down with a benefit counselor and hearing about this benefit because this is nothing like anything else that we offer. And so the enrollment firm was very excited because they were able to, gain that employee access that they had been struggling to get for the last several years. And ultimately, we ended up getting about a 16% participation across the board. And what we're seeing is that a lot of the employees who have critical illness or cancer are the ones that are enrolling in the same benefit, because it tells that nice story of kind of that term and perm story that you hear with life insurance, where your critical illness or your cancer policy is great because it's going to provide that financial safety net, but it's not going to fix the problem. So having, the financial safety net from your critical illness policy and then having the Cancer Guardian program be able to actually provide tangible services that could have a significant impact on your overall chance of survival is just a really dynamic combination. This next case study, this is an employer-paid client. There are about 2,300 lives. They are a life insurance company. This is actually Penn Mutual, the life insurance company. They put this program into effect the middle of last year. And, they are sensitive to their cancer burden. They knew they had a higher than average cancer incident. They have a very expansive benefits package. They have pretty much every benefit out there. And when they were doing a review of their benefits, they said, gosh, we have so many benefits we offer, but we really don't have anything that is cancer specific. And so they really saw the value in this, and they actually pay for this program for all of their employees and all spouses. So it's been a really great benefit for them and being able to help their employees and family members who are dealing with cancer. All right, and there are a couple of pieces of an ROI that can really help kind of strengthen that conversation when you're speaking to your clients, and ultimately if the CFO is getting involved in those conversations. So as it relates to ROI from the hereditary risk screening test that I talked about, that all of our participants get access to as soon as they enroll in the program, this is really around prevention and catching diagnoses earlier on. So having those genetic markers that tell you what your increased risk is based on a hereditary component can help people be more planful and preventative. Maybe that information is going to require them to have, earlier and more frequent preventative screenings, which can help them catch a cancer in a much earlier stage, which, as I mentioned previously, is going to improve their 5-year survival rates by 4 times. And it's actually going to reduce treatment costs anywhere from 50 to 90%. It costs much higher from a healthcare utilization perspective to treat a late-stage cancer than it does an earlier stage cancer. So big benefit there for an employer. There's also some ROI as it relates to the medication response reporting that's included in that risk screening test. When you look at behavioral health drugs, there's a very high rate of failing the initial therapy. So 30 to 50% of individuals actually fail the initial therapy that they're put on. And a lot of that has to do with underlying genetic markers that are impacting how they actually respond to those medications. So having that genetic information up front to let people know that they're taking the right medication at the right dose for them is going to help improve their symptoms, make sure they're getting the maximum efficacy from the drug that they're taking, and then that can equate anywhere from $1,000 to $5,000 per patient annual savings on the healthcare utilization. All right, and this last piece here, this is really around the advanced DNA testing of the cancer. So from having that DNA testing, there's definitely some ROI cost avoidance associated with reducing misdiagnosis and getting people enrolled in clinical trials. So an average 1,000-life client, based on the national cancer incidence and the average reportings on misdiagnosis, a 1,000-life client could expect to have at least one cancer diagnosis that is misdiagnosed each year. And a misdiagnosis can run on average anywhere from just over $21,000 just on the actual misdiagnosis. That doesn't even start to take into account if somebody had started treatment and they were on the wrong treatment. That could be, a pretty heavy lift on healthcare spend in itself. So reducing the risk of misdiagnosis, you have the potential, on a 1,000-life group to eliminate over $20,000 in wasted spend each year. And then when you're looking at treatment expenses and being able to enroll people in clinical trials, the average cost of cancer treatment is roughly $10,000 per month. And that is a conservative estimate. There are definitely treatments that are higher than $10,000 per month. But the Cancer Guardian, the advanced DNA testing included in the program, having that access to that genetic information actually doubles an individual's chance that they will qualify for a clinical trial. Now, once an individual is enrolled in a clinical trial, they now come off the group health plan as far as the treatment costs are related. So the drug companies are now going to be picking up the cost of those treatment expenses. So that's a huge advantage to an employer from a cost perspective. And, clinical trials are so key in advancing cancer treatments. The drugs, the most advanced treatments today were in clinical trials, just a couple of years ago. And the most advanced treatments of the future are in clinical trials right now. There's a big opportunity to, improve overall survivability by getting people more access to clinical trials. And just one last piece of information to close it up here today. our program is very cancer specific, and we do have a partnership with the American Cancer Society to do fundraising for, cancer research and specifically genetics and improving cancer treatments. So we do make a monetary contribution for each individual that we have enrolled in our Cancer Guardian program each year on an annual basis. And that's just one of the many ways that we do fundraising for the American Cancer Society to have funds put back into research for cancer genetics and improving treatments. So again, this is a great way for you to, bring something new and exciting to your clients that they more than likely haven't heard about before. It's a way to make sure that they're providing access to personalized cancer navigation support and advanced DNA testing to show their employees that they're really going to be there for them at one of life's most critical junctures. Our team here, our business development team is here to help you all. If you have any, prospects that you think would be interested in learning more about this program, we're happy to get involved and, get you trained up on having that conversation or participate in any, calls or meetings with you and your prospects as you're getting comfortable with the program. So your team, Sean Ferguson, Ty Ellison, and Gresham Olson all have our contact information. So they'll be able to get you in contact with us to help working on specific prospects. And we are working with Acrisure headquarters to put a national agreement in place. So there'll be more information that will be sent out to you shortly on that. But thank you for your time, and we look forward to partnering with you all in 2019. Thank you.